Today's your day, Lyndle. What?
I have to go by the fact that I already got hot. Because when I first came in here, it was really hot.
It is really hot. So the temperature outside right now is 90, and it is, well, it's 11:15. Lyndle's getting her hair done today. We're getting a haircut, and they're gonna style it too. She's going to the girl that does my hair. I feel like a runway model with the wind blowing in my hair. I took Barry yesterday to do some...
You're having fun.
You're already having fun?
No, I'm gonna be happy.
Yes. Took Barry yesterday to do some errands, and then we went by Dick's and got him a t-shirt and had a lot of fun. I didn't vlog it all, but I have a lot of photo evidence that he was with me. He definitely got a hold of my camera and took a lot of selfies. So, but yeah, I didn't pull out the camera. I didn't even take it with me. So, but this being Lyndle's first actual haircut since she was probably 6 months old, this is exciting. Your hair's getting very long. I'm hoping for her to get a cut, like keep most of the length, but cut it in a way that it may not get as tangly like at the pool, because that's kind of what we're struggling with, is with swimming it gets tangly. Yes, ma'am. Is it gonna get hot? What?
Cut on the little bottom.
Oh, cut a little on the bottom? Yes. You get to ask her for whatever you want. And she's gonna wash it and dry it too.
Wait, just put my hair in a little bathtub.
Yep, exactly.
Make a little bowl, fill it up, and then I'll sit on my tail, and then it's gonna be a little bit like that.
Correct.
And then
Yes.
that's just like laying down in the water when I get in the bathtub.
Exactly, but
I
only
like doing that.
your hair's gonna get wet.
Yep, I like doing that too.
Cool. Let's do it.
Okay.
Okay, let's go. Are you excited? When is she coming? She said she was running a little bit behind, but she'll be up here soon. Yeah, you can sit down.
Lay down. Just let him take a nap. Good job.
This is my favorite part.
First dose, semi-complete?
Does she look traumatized?
No, not at all. Quite the opposite. So it's a beta blocker, and it's, what, 1 milliliter?
1 milliliter orally. Some of them they treat topically with literal ophthalmic timolol.
Oh, really?
Yep.
Well, we have plenty of that laying around.
Yeah, exactly. But she said there's no research that showed. Hey, we never talked about it.
Never talked about what?
The appointment.
Just a little bit, yeah, yesterday.
You did? We
No,
talked
we-
about it, promising we would update on it.
I know, but yeah, I did just a little bit.
Oh, okay.
But yeah, you need to probably go more in depth
Yeah.
later.
She said, yeah, I promise it's coming. She said that like doing the topical in addition to the oral doesn't have any added benefit. But if like, she said some of the smaller ones aren't as responsive to the oral as the bigger ones.
So we might as well go ahead and do it?
So she said, yeah, give it a week or two, and if it seems like some of the the superficial ones aren't going away, which I really, like, other than cosmetic, there's no risk to the little ones.
Well, that older gentleman at the dance recital literally came up and touched both of her.
They're like a polka dot for
True story, folks. True story.
And my daddy's there.
For that guy.
So I just
Yeah, that medicine does not go down easily.
sick apples.
I wonder if you should add a spoonful of sugar.
Until you have white
It does help medicine go down. I did that as a kid after I took Dimetap. I got a spoonful of sugar. It's not good.
No, that would
Doesn't
not.
taste good. Yeah, so she very effectively spit it back out. And I asked at the doctor's office if she spits up after she has her medicine, if I should redose, and she said no. But she literally spit out the medication, so we gave her just a little bit more. I don't know.
Obviously traumatized.
Yeah, poor baby. But having to do that twice a day, and she's like all sticky all over because it was a sticky medication. And
Right.
I'm not,
How long is she gonna be on it? Like a month?
a year.
A whole year?
A year.
Oh my Lanta.
Twice a day for how long is she gonna be on it? Like a month?
Oh jeez.
A year.
Ugh.
She said at like 6 to 8 months they changed the formulation to be more like a tasty.
Bubble gum or something.
Yeah, but at this age they don't. And actually, I'm thinking back, we had to give Lyndle Zantac, remember? Because she had reflux.
Yeah.
Reflux. And I would like slip it into the corner of her mouth while she was nursing and just really slowly
Yeah.
administer it, and it
Right.
worked. Maybe I should try that.
Yeah,
I
totally.
just don't want to like compromise a nursing relationship
Right.
doing that.
Yeah, exactly.
And I'm afraid my nipple now tastes like it. And she won't. I'm scared.
Yeah.
I'm gonna go wash my nipple.
Okay, are you ready to give us the full rundown of the pediatric dermatologist appointment?
Sure.
Okay, what do you got?
Okay.
Well, first of all, it was a car ride that was like, what, hour and 15 minutes?
Yeah, around an hour to Jeff City.
An hour to the
An hour.
most.
Yeah. It was supposed to be in Columbia, which is hour and a half, sometimes 2 hours, depending on traffic. But luckily, her pediatric dermatologist was in Jeff City 2 days out of the week, so we went there. Much better. Because I was thinking it was going to be like Eloise. It felt very similar to Eloise when she was having like her kidney scans and stuff.
Right.
Up in Columbia. Anyway, Jeff City. Went up there and nurse practitioner saw her first, which I thought we were going to end up just seeing the nurse practitioner, which actually made me feel a little bit better for some reason. Like, I feel like in a specialty dermatology practice, the nurse practitioner is probably given the cases that are more straightforward. You know what I mean?
Yeah.
So it made me feel a little better. But then turns out she was just training under the pediatric dermatologist, so
Gotcha.
she came in as well. And they counted them, and they came up with 9. The 3 that I thought were like either new ones or smaller ones were more like stork bites.
Gotcha.
So luckily I don't know. So it turns out the hemangiomas are totally different than stork bites. I thought they were kind of synonymous. Did you?
I guess I never really knew the difference.
Yeah. They're like, the hemangiomas are an actual tumor, and stork bites or angel kisses or whatever, I mean, there's a bunch of terms that they use to describe a stork bite, are like an anomaly of microcapillaries or something. So anyway, she like evaluated them, and she said there's definitely a cosmetic component because they're on the central face, and that alone is sometimes enough for parents to choose to treat them. There's also the potential with really fast growing ones that they can ulcerate in the middle, and that causes some problems, obviously. So she didn't want that to happen. The one on the top of her head, I think, is the one she was most concerned about for like how fast it's growing and
Yeah, it's
the
huge.
potential for ulcerating.
Right.
There's a couple others though that have grown a lot, like this one on her arm. Have you seen this one?
Yeah.
She doesn't want me to show you.
Yeah.
That one, and then There's one on
Like right above her butt crack.
Yeah, that one, and then like on her upper back. Those 3 in particular are growing really fast. So we all agreed that it would be a good idea to start an oral beta blocker, which we did today. It's indicated to be started at 5 weeks, and she will be 5 weeks on Thursday. So we started it a little bit early, but she said it would be fine. It's already working. Like
one day.
The one on the top, like before we even started the second dose, before we even gave her the second dose, it was starting to work. Like the one on top of her head is softer. And she said that's what would happen is it goes from being really firm as it grows to kind of softening, and then like it'll stop growing. And then the ones that are flat and just kind of red will become like less, what's the word for
red?
Yeah, like less saturated. Less red. Less dark. They'll lighten up, I guess. And the one on the side of her face has already lightened up.
Really?
Yes.
Okay.
The heart one.
Oh.
I know. So anyway, we're going to follow up every month because the medication is based on her weight. That changes pretty quickly at this age. So she at least needs to like go up and get weighed. They also want to watch and see how things are progressing. But it was interesting to hear about, like, this is the treatment that came up within the last 15 years.
Really?
Mm-hmm.
Yeah, I wonder how they discovered that.
She told me.
Oh.
There was a little boy, so like this is obviously a medication that's used for heart conditions, and there was a little boy who happened to have the heart condition as well as a bunch of hemangiomas.
Yeah.
And so they had him in the hospital starting on a beta blocker and noticed that his hemangiomas were disappearing.
Weird.
Yep.
Huh.
So then any patient that they started on this off-label for hemangiomas, they had to have them admitted into the hospital while they started them on the beta blocker to monitor like their blood pressure and their heart rate and all that while they got them going. And then they were finding that everybody was fine. And then they would have them do it in the office, and they would have to stay for like 4 hours and monitor vitals.
Oh, thank God they don't do that anymore.
I know. So, and they, I mean, over and over again discovered that everybody was fine. So here we are, 15 years later. And I was like, well, what would they do before that? And she said it was brutal what they would do.
Like cut them out?
Yeah. Well, they would put them on high doses of steroids. They would inject them with steroids. Just like brutal treatment before. And that was only if they were obstructing the pupil or like pressing into the airway or like causing some other collateral damage. The comorbidity of them was too risky for them to let them keep growing, and they would do those things to stop them.
Dang.
I know. So anyway, that is
That is that.
the full update.
Alright, well, time to feed these little girls and go to bed.